ቦታ ቢትሉ ሁሉም ጤና ጣቢያ ላይ ቢትሉ የሚታገኙት ምክር በዚህ መጽሐፍ መሰረት ነው
ያው የኢትዮጵያን primary health care guideline
The health center was one of the facilities that piloted the EPHCG program. Some level of professional inadequacy is expected at primary healthcare level. The guideline helps provide clinical guidance for those professionals with a knowledge gap, hence minimizing the risk of hurting the patient. This guideline helps healthcare providers to improve the outcome of care.
This guideline helps ensure that all health professionals are on the same page. Back in the days, it was common to see patients demanding to be treated by a specific doctor, mainly with their own prejudice that one professional is better than the other. But now, since all professionals are treating patients based on the guideline, service provisions are provided among doctors equally to all patients. The implementation of the guidelines should be strengthened and continuous. Currently, our facility is fully implementing the guideline.
መድኃኒት እንሰጥሻለን ያ መድኃኒት ደግሞ ለ3 ወር በቀን አንዴ በተመሳሳይ ሰዓት የሚወሰድ ሲኦሲ የሚባል እቺኛዋን መድኃኒት ትወስጃለሽ ያንን ለ3 ወር ትወስጂና ምንም አይነት ለውጥ ከሌለሽ ደግሞ ጋይድላይንሱ እንደሚለው በቀጠሮ ተመጭና ultrasound ተነሻለሽ ultrasound ደግሞ
We inform clients about the importance of this guideline in order to avoid any confusions that may occur while health professionals refer to the guideline during treatment. We also try to build their confidence by explaining that the guideline is being implemented across facilities to standardize treatments. We educate the community about the guideline and we keep records and reports of all this awareness creation session we provide.
Emergency services are provided at 3 levels. These are pre-facility, in-facility, and post-facility emergency services. Skill gaps were previously identified at the pre-facility emergency level. One of the main skill gaps being the inability of the community, teachers, EMTs, and some other health professionals to effectively provide first aid. In order to address this gap, we are now giving out first aid training, especially for those teachers in primary school. In regards to the in-facility service, we do our best to make sure we have a capable emergency team that includes a mix of all necessary Iliad health professionals. Furthermore, we have emergency task force. This team is on standby for exceptional situations like accidents with mass casualties. In such massive emergencies, led by the leader, this team takes over in order to avoid chaos. Whenever the emergency alarm is set off in the facility, the task force member assemble at the emergency room.
Our facility implements a childhood growth monitoring program in which we monitor the growth of children from the early ages. This helps to identify those who need special follow-ups. This helps the children to attain a healthy brain development. We have a dedicated health professional for this service. Furthermore, we set up play dates twice a week where a team of professionals teach mothers how to play with their children.
የሚጫወቱበት ቦታ አለን ፕሌግራውንድ አለ
80% of your child's brain development is determined from the time of pregnancy up to the age of 3. Since your child is at this critical age, you and her father need to pay special attention to her. You should interact, talk, and play with her often while also making her environment child-friendly. This here is the pediatric treatment room. We mostly treat sick children here. What makes this room different from other facilities' pediatric treatment room is the fact that we assess children's growth and development. In the past, when a parent comes in, concerned about the delay in their child's speech development, we used to just tell them that it was normal for some kids to start speaking late and that there's nothing they could do about it. But now that we have received training on the child's development monitoring, we are capable of identifying kids with delayed speech development and provide the necessary assistance.
Our facility is actively working to fight the COVID-19 pandemic. We work on surveillances, testing, and isolation of patients. We also have a team that meets up weekly to evaluate activities related to COVID-19 response. This team is composed of health professionals. They formally review the work that has been done and report issues that will be presented to management and resolved. For those reasons, our COVID-19 response works were effective. Our facility were also recognized by the subsidy for our work regarding COVID-19 testing.
We recently completed the third round vaccination campaign and are now giving the vaccine on a regular basis. Through time, people are accepting the vaccine. The vaccine is now available at all time in our facility. People have also started asking for it now. This is a huge change. At the beginning, we were only able to provide the vaccine for elders and those groups who were vulnerable. Now, the vaccine is available on a regular basis for anyone older than age 12. We provide a wide variety of services. We actively work on disease prevention. We also care for elders and chronically sick patients in the community. We also provide emergency care when needed. In addition to treatments, we also provide health education. We work on sanitation and psychiatry problems in the community. We have psychiatrists available here. We scan for psychiatric patients that are hiding in the community and try to enroll them in the treatment. We go to their house and bring them to the health center for treatments. For the cases beyond our capacity, we refer to hospitals. The family health team has brought many benefits to the community health system. For example, the team was very effective in fighting against COVID-19 pandemic. Because we knew the ins and outs of the community, we were effective in the prevention and control work. We believe intervention should be more focused at the community level.
Our facility ensures access to the handicapped. We have ramps that go to the first floor. Since the delivery room is also at the first level, women in labor can be rolled up to the room in a wheelchair using the ramp. Wheelchairs and stretchers are also available for all our clients.
All kinds of services for handicaps are made available in this room. It's not only treatments we provide here, but also any type of counseling services. For example, if a handicap comes in for a certain type of consultation, we call on the health professionals to come down to this room to provide the consultation needed. I go around each room to facilitate communication between health providers and deaf patients. Now, clients with hearing disabilities are so happy just to know there is someone who can assist them and understand them.
You are now in the DHIS room. The DHIS room is where every work done or service provided gets reported. The purpose of the room is to process data and change it into information. We compile records from different rooms and turn it into one record. We then compile the data and feed it in the system. I think the system is being implemented in every other facility out there. I believe what makes us different is how we utilize the information. We were effective in using the information to dictate changes on the ground. We used both the weakness and strength that we identified.
Even though they have many clients, all the staff treat us very well here. I like the service very much.
I come here once a month for my follow-up. I have never faced a problem. As a health facility here in Africa, I think it's very good. It is possible to perform even with the limited resources. Until we get what we want, we have to accept and strive with what we have. Resource scarcity is common everywhere. Therefore, our goal should be to make sure we utilize the resources efficiently.